So I think Star kind of wanted me to talk about kind of the cancer care committee we have here in Gillette. That's part of our Community Health Foundation. It used to be the Campbell County Healthcare Foundation. And a couple of years ago, Nichelle, the director, rebranded, and now it's the new Community Health Foundation, Northeast Wyoming Community Health Foundation. And then I thought I'd talk about the Heptner Cancer Center a little bit because I'm also the director of the Cancer Center as well. So you can go to the next slide. So kind of a history behind the Cancer Committee and how and why we started. We started the Cancer Committee in 2013, myself and Nichelle, the director of the foundation. So basically, kind of in 98, 99, there was a big capital project with the foundation to build the radiation side of the Cancer Center that raised a couple $1 million to build the vault and put in the radiation, the linear accelerator and stuff. There was some money left over from that project that kind of sat in a cancer kind of account through the foundation that kind of sat untouched for lots of years. And I was pretty involved with Relay for Life for a lot of years, kind of as the team coordinator. And I'm not dissing or taking away from Relay for Life or the American Cancer Society, but we'd raise a lot of money every year, and it was kind of disheartening to see all the money that we'd raise not stay as local as we wanted. So Nichelle and I got together and thought, what can we do with some of this money that's kind of been sitting in these accounts? Sorry, these accounts that are kind of dormant. And so we decided to kind of create an umbrella with the foundation and create this cancer care committee to help patients locally financially during their cancer treatments. So we started this cancer care committee. So patients can apply for grants during their cancer treatments. So they do have to be on an active treatment, either chemo, radiation, surgery, some sort of active treatment. We did have to come up with that.
May I have your attention, please?
Sorry.
Respiratory, please call dialysis at 1982.
Figured you didn't want to hear the dialysis page. So we did kind of have to, you know, as much as we'd love to help every survivor in the community, we did have to kind of come up with some stipulations on having patients be on active treatment. But during their treatments, they can apply for grants up to $2,500 to help them with travel or travel expenses. We've had patients apply for money to help them with like dentures if they're going through head and neck treatment and need dentures. We had a lady one winter, her roof was leaking, her heat went out, so it helped her, you know, fix her furnace, those kinds of things. We had a lady recently that she had really pretty red hair and she wanted a specific wig, so we helped her buy her wig. So really, we don't ask for receipts afterwards. It's a very simple application. They kind of tell us, you know, their story of their cancer diagnosis and how the money could help them. And then we do ask for pay stubs of them and if they have a spouse. And then the committee meets once a month and we review all the applications, and then they get a check mailed to them usually that week. So that's how the funding kind of started, was this leftover money through the capital project. But through the years, obviously it's grown through our fundraising that we do, and then memorials. Obviously, when a lot of patients pass away, the family might ask that memorials get sent to the Cancer Center or to the committee. So that's kind of how we've grown and sustained the money. All the money we do raise stays local, which a lot of the community has kind of rallied around that. And the patients can apply for grants once every 12 months. So say we get a metastatic patient, as long as they're on active patients, they can apply again after their 12 months is up. So You can go to the next slide. So I already talked about this, but our application is available on the Community Health Foundation website, and then all of the patients get a copy of the application in their new packets that they get either on the chemo or the radiation side. And then Rhonda, our navigator, also gives a lot of applications out, so they can get it there too. Our committee meets once a month. We review the applications, and then we have a $9,000 a max monthly we can give out. So that kind of sometimes monthly causes a little bit of a hiccup when, say, we've got seven, say we have 7 applications and we have the $9,000 max. You can do the math and realize that not everybody's going to get the max amount. And so that's kind of where the committee, we have to do a little bit of, crucial conversations as far as which patients have had like a loss of income due to their diagnosis. Has their spouse also had a loss of income due to their diagnosis? Are they having to travel? It's kind of tough to have those conversations, but if you have a patient that's still able to work and their spouse is able to work, and maybe their kids are grown and out of the house and they've got a good insurance, not that they don't have a need, but maybe their need is a little less than the other couple who's got 3 little kids at home and both of them are having to travel to Denver twice a month, or we still help them in some capacity, but they might not get the full amount like maybe the other couple. So that's something we've really had to learn how to kind of deal with through the years. But I feel like our committee, we've got a really good variety of community members on our committee. We've got a couple survivors, myself and Rhonda as the navigator. We've got Nichelle as the director. We've got an accountant, a couple other foundation committee members. Trying to think who else is on there. We used to have an attorney that helped write the bylaws. He got really busy and had to leave the committee, but just a really good kind of round group. So we have a social worker. So it's a good group that kind of brings different things and different views to the table. Because it's easy for us that kind of know the patients and work at the center to kind of have our own views, but it's always good to have, outside viewpoints to bring to the table. So next slide. So our biggest fundraiser that kind of sustains our funding is Paint Gillette Pink. We used to have one other fundraiser called the Chair Affair that really wasn't it did okay. I don't want to down the fact that it didn't raise some money, but it was a lot of work for not a lot of fundraising. And so we kind of put that to the wayside a couple of years ago during COVID, when we had to kind of back away from in-person fundraising. So we really have just kind of honed our time and efforts into Paint Gillette Pink. You can go to the next slide, Star. So really, it's a community-wide fundraising event through the month of October. And I say October, but really it kind of starts in July. Some events kind of kick off in July and continue all the way through October. We have a 5K. This year we have our first car and bike show. That's actually this coming Saturday. There's bake sales. We have donation jars set up different places in the community. Some businesses do cornhole tournaments. We have a poker run with Harleys. The 2 high schools, we have rival high school games now. They do a football helmet raffle. There's trivia nights at a couple of the bars. 2 of the big car dealers donate a portion of their sales. It's just kind of really taken off through the years. We don't necessarily have a big committee sponsored event, except for this year. I should take that back. We're actually sponsoring the 5K, our committee is, but it's really just taken off in the community, and more businesses just kind of chime in every year and do their own thing, and we just support them as we can. So we did start Paint Gillette Pink 6 years ago and raised about 24 grand that year, but last year we raised over 93,000. So you can kind of see where we've kind of grown through the years and how we were able to sustain that kind of $9,000 a year in our grants to our patients. So you can go to the next slide. So some other things our cancer committee supports besides our patient grants is we do have a breast prosthetic grant through STAR and the gang at the state level. We also got we have a festival of trees, I think like a lot of the communities in the state do, that I applied for a grant through that helps patients with penguin caps, the cold cap therapy. We're still kind of in the middle of building that. It hasn't taken off like we wanted to, as Rhonda's probably shaking her head with me. We're having some logistical issues with some dry ice and some training and stuff, but the committee supports that. And then Rhonda's position as a part-time patient navigator is also paid through a grant through the state. The cancer committee also supports a cancer exercise class through one of our local rehab patient or physical therapy businesses here in town. We have a breast cancer support group. Rhonda has kind of taken the lead on a men's coffee and cinnamon rolls kind of group that is also through a grant through the state. We tried a men's support group, and I think I talked about this maybe at the last survivorship group, but we couldn't really get a men's support group to kind of take off. But Rhonda had a great idea to kind of do a less formal way, and she had 4 men show up to this coffee and cinnamon rolls group at Lulabelle's, this kind of mom pop cafe here that we think is going to be a great kind of alternative. And then we do gas cards through Festival of Trees grant money, and then also through part of a grant that I have through the state. So kind of in general, the cancer committee supports me through a lot of these things. Nichelle helps me with a lot of the marketing and flyers and that kind of stuff. Next slide. Sorry, am I going too fast for everybody? It's kind of a lot. And then the cancer center in general, we have medical oncology and radiation oncology. We're kind of on the annex side of the hospital. We are attached to the hospital. So we have a full-time medical oncologist, Dr. Pauline Lerma, and we have a full-time nurse practitioner, Stacy Hostreiter. And then we have a full-time radiation oncologist, Dr. John Bergen. He is new to us as of last fall. We had Dr. John Stamato here 1 or 2 days a week for years and years. And Dr. John Bergen is now full-time, which has been a great addition to us. So kind of a new thing, when COVID hit 3 years ago, they closed our hospice house across the street, which was unfortunate for the community. But after doing some soul searching and some other stuff, administration decided not to reopen the hospice house due to some fiscal losses. And so that building has sat empty for a long time. And there's 6 hospice rooms across there. It's a beautiful building. The lower level of the building is used for our home health and hospice employees, but the upper level has been empty. So administration is decided to move our chemotherapy department across the street so that patients can have, I don't know if any of you have been in our chemotherapy area now, but there's no windows. It's very dark. They're just kind of infusion type of bays. And so they're going to move the chemotherapy, including the providers, across the street after the state comes and surveys and we finish a few more things across the street. So it'll be a little bit logistically, got some barriers to kind of get over, but the patients will all have their own rooms with their own bathrooms. They'll have windows. Each room has like their own little patio. So we're excited to have the patients kind of have a really pretty building and actually just have something in the building. The community is pretty excited about it. So that will happen in the next couple months. We're still not sure when that's going to happen. The other good thing about that is right now, the cancer center or the infusion center, we do non-chemo infusions also. So you might have an antibiotic patient sitting right next to a chemotherapy patient, which we all know having an immunocompromised patient next to an infectious patient is not the greatest idea in the world. So this will separate the non-chemo infusions from the chemo infusions. So the non-chemo infusions will stay here in the building, and then the chemo infusions will go across the street. So lots of change going on here, but it'll be exciting once it's all kind of done. So, and then next, I guess that's it. Is there any questions? I talked kind of fast. I tend to do that. Rhonda, do you have anything to add? I see she's on.
Oh.
Oh.
Sorry. Am I unmuted?
Yes, I can hear you.
Okay, good. No, I can't really think of anything other than, just that we're trying to work with the community to, or I am anyway, I guess, with the rodeo community, and kind of hoping to have something done with that, as far as it's not necessarily tough enough to wear pink, but something similar to that. And so just working on that to bring in some more money for our cancer committee. So
yeah, we're always trying to kind of look at new ways to kind of bring in, some new funds for, like this car and bike show that we're having Saturday is a whole new kind of genre. Genre is not the word. New population of people, I guess. It's a new group of people that, new sponsors that we're not used to. The foundation kind of has their normal group of people that are kind of reoccurring donors. So we're getting a whole new group of sponsors and population of people that are super excited to kind of be joining. I should say another thing I didn't list. We have a really talented tattoo artist here in town, Mo Sullivan, with Mo's Tattoos. She lost her father to cancer a couple years ago, and she came to me about a year and a half ago and was very interested in donating her time to cancer patients. So she's now been trained in nipple and mastectomy scar tattoos. So we support her, the committee does. We kind of have an account set up under the cancer committee to help her. She donates her time and stuff, but when she gets money donated to her, we kind of help her with supplies and stuff. She's got a medical grade shop for mastectomy scar. She'll do any, like if you've got a sarcoma, she'll tattoo your scar for free. And she's working with a local pain anesthesia doctor too, to help with some of the numbing stuff. But she's part of this bike and car show too. So she's really taken off in helping the cancer community too. So lots of cool things. Just trying to help the patients. So
yeah. And we also have the boutique.
Oh yes, we have the boutique. Sorry, I didn't even put that on there. We do have the boutique. It's got wigs and mastectomy stuff in it. We've got some Gillette Pink t-shirts in there that Rhonda's been selling in there. Scarves, hats, education materials, all kinds of stuff in there.
Thank you so much.
Which that will move across the street as well, because the majority of the patients that kind of dive into their, obviously a lot of them are chemo patients. So we're going to move that across the street when the move happens. There's a room over there we can use. So
are there any other questions for Leigh or Rhonda on the services that they offer in the Gillette area for cancer survivors?
I was just going to ask a lot of really awesome stuff going on. Do you have any idea when some of the grants might run out, and do you anticipate, just having other grants that will keep the same services going?
I didn't understand you, Jana. Sorry. It's kind of.
I just said for a lot of your stuff right now, I mean, you said you have quite a few different grants. Do you have an idea? Are some of those things going to stop when grants run out, or do you think you'll be able to like get other grants, to keep it all going.
Yeah, did you ask if I can keep some of those grants or keep them going? Yeah, we're just kind of seeing how, one of them I was able to extend the mastectomy one because we didn't use Correct Star, so I've got that one still going. Rhonda's, I'm hoping to kind of show the worth of it and extend it to make it a full-time through the hospital. That was kind of my hope with hers, was to show the worth of hers and see if CCH would make it a full-time position through CCH. So we're kind of work in progress with that. So
That's awesome. That's awesome. Yeah, you guys have a lot of really good stuff.
Thanks.
Awesome. Okay.
Rhonda's been a lifesaver, I'll tell you that.
Right. Thank you so much for presenting on those services.